Actually, I didn't believe in the whole systems of care theory or concept early on because I was so, I guess, siloed and in my own world of juvenile probation. I thought that the agencies that had their youth end up in our juvenile justice system just weren't doing their job. And I had to pick up the pieces for some things that they didn't do. And I, felt that it was just, well, here we go again. There's juvenile probation here to save the day all over again. But then as we got this grant and began to work through this grant, I began to understand a little bit more about other systems and understand their language and understand their procedures and their mandates and what they could or could not do. I began to still fight a little bit. My whole thing was, how can we share information with each other? It's confidential. How can I bring a therapist? What do you mean a custodian can reach a kid better than a therapist? That can't be. They're a custodian. Little did I know that it could have been anybody that could reach that child. Little did I know that it didn't take someone that had 18 years of textbook knowledge to reach a child. It could have been the school nurse. It could have been the cafeteria lady that took time to sit with that child in the cafeteria when nobody wanted to talk to her. That made that impact. So I didn't really realize that till I actually became involved in the whole system of care. And then I had to learn and navigate through systems myself. And I did that as a quote-unquote professional, and I have found it very difficult. We came together as a community. As we came together as a community, I realized that this is what it takes to get things done, for us to understand the issue, understand the problem, but understand how we come to a common solution within the systems. And once we began to have that conversation, began to do the cross-training, began to listen to the families and the youths, I began to see things change. I mean, at this point, I am so blessed to live in my community of El Paso, where I have probably every child social service agency on a direct line on my cell phone to their office, 2 personal cell phones, where we can act immediately on a situation that may have come through our doors. Let's make it a constant that for generations to come. This is how we treat our children and families in El Paso, in Texas, and hopefully the United States.